There's going to be a lot of information in here. This PowerPoint will be made available to you afterwards, so don't worry about writing down everything. It will all be available for you. Like I said, there's going to be a lot of information. The main thing that I can emphasize for you as we're moving through this is get in contact with your social service team if you have not already. This is a big resource that a lot of patients that, in my experience, don't fully utilize. So this is a really big thing that after we finish today's session, your social service team member, social worker, nurse navigator will be able to kind of continue this work with you. So this is kind of a primer, you know, it's kind of like drinking water out of a fire hose. So if you don't get everything, that's fine. The other thing I'll say is if you have any questions, just let me know. I want this to be interactive to the best extent possible.
All right, first question, how do we get a social service team or
how do you get a social worker?
Social worker? I mean, do I go down to the downtown and say, I need help, I got cancer, who do I talk to?
Great, good question. So do you have a doctor?
Sure do.
That's who you talk to. You talk to your doctor, your nurse, who's your medical provider, and say, hey, do you have a social worker? I need a social worker. They will be able to provide you one. So I know every major medical oncology group in Atlanta, they all have social service team members. So they either partner with someone, if you don't know them, just ask to be introduced to them. A lot of times that doesn't happen automatically with every patient, but if you need additional help and you don't know anyone else, you don't know a social worker, that sort of thing, talk to your doctor, talk to your medical team. So if you call into your medical office, you'll probably get a nurse who will respond back to you, say, hey, I need help with finances, can you hook me up with a social worker? That's all that you need to do. So this didn't used to be the case, but now there's more and more, pretty much every medical group in Atlanta has social work team that works with them. So where do you go, Northside, Piedmont?
Well, I'm at a Long Street clinic at Gainesville, where I've been.
Okay, all right. So I would encourage you to talk to your medical team and see what they have kind of moving forward, all right? Yes, ma'am.
I would like to ask a question. Why don't they tell people about the social worker when you go to your doctor? Because when they go to the doctor and everything, they don't know until they tell them about it. They don't know what to ask for.
So that's a great question. So the question was, why don't you automatically get linked up with a social worker when you start your treatment? I would prefer that to be the case because, as we know, cancer is just not a medical challenge. It's a social challenge, it's a psychological challenge, and it's a financial challenge. And so as to why that's happening, that's a larger question, maybe for another lecture. But what I can say is that how does this relate to you? How can you get linked up with so you hear the term, the squeaky wheel gets the grease. You need to use your voice. And so that's very important. So in an ideal world, everyone would have a social worker, right? And that would be linked up with you automatically. What I can say is what they have implemented is distress screening. So chances are, every center has to have some sort of distress screening. If you're above a certain cutoff, you usually get contacted by a social worker. So it could be possible that your distress wasn't high enough. The long and the short of it is social work.
Financial stress?
I'm sorry?
Is this financial stress?
Yeah, all different kinds of distress. Yeah, so there's usually a distress screening tool that occurs. If that has not occurred, regardless, you can still ask for one. The short answer to that is social services aren't generally compensated by insurance, so it's not really a money-making endeavor. So usually the social workers are employed to help patients, but they're not as robustly employed, say, as nurses or doctors. But again, that's another conversation. But I appreciate that question. And if you do talk to your doctor, say, we need more social workers. That's what I would say. Yes, ma'am.
just real quick, you don't know what you don't know. And then number one, just for this gentleman, I would recommend you try and find a support group in your area, which would be a great resource for you, a support group.
One other plug, thank you for that, that's great.
Yeah, I mean, that's, you know, they're awesome to find a support group, then you get around people that have what you got, and then you can see, oh, okay, you know, they're living normal lives, and you share experiences, and you know what I mean, it's a great resource.
I actually am paying her to
Yeah.
plug our support group. So we actually do have, if you don't have a support group near you, you can go onto LLS's website and sign up for a virtual support group. So our friend Tanju is over here. He's been part of the support group for going on close to 2 years.
Good.
So if you have any questions about that, Tanju's he's a solid member of the group, so you can ask him. But I lead that group, it's 3 times a month. So if you want to, oftentimes, I don't have all the information either. Sometimes our patients or clients that we work with, they have a lot of information they've experienced along the way. And so support groups are a great way to kind of get experience that you haven't had from other individuals that have gone through it. Yes, Tanji.
Yeah, I guess I would comment to the question, why don't they tell us about social workers and doctor? I think also,
Speak up, speak up.
I think they don't tell us, they tell us, but they kind of use code words, right? So coming to these events or going in groups helps us understand what we don't know. So I remember now, in retrospect, I remember hearing about a nurse navigator in the hospital some miles in Keystone. I didn't understand what that was. I didn't understand that.
Right,
before,
right.
I just kind of ignored it, right? I was already overwhelmed with the diagnosis, right, and all that. So they use code words, it's a hospital system, and insurance, all that gets complicated, but a lot of it is coming to these events, showing in groups. Sometimes you find a group that doesn't quite work for you, they don't meet enough, so we're looking for another group as well, right? That might be cool. I think in our group here that kind of serves Atlanta Southeast, some of the people on that call are part of multiple different groups, right? 'Cause 3 times a month's not enough for them, right? And so that's something to be aware of too. The groups, a lot of it's driven by volunteers after hours. You know, Mark, it's 5 p.m. Just wait for him when he does it. And you know, you kind of gotta put what you can put into it, kind of what you get out of it too. So.
Yeah, so long and the short of it, just say, hey, give me a social worker, right? So that's the way to kind of break on through, because a lot of times that isn't always good. That isn't always presented, and if it is, you might have a lot of other stuff going on too, like, well, what does this treatment even mean? I don't care about a social worker right now, I just need to get my treatment started. So, anyways, we'll come back to this at the end, but we'll keep moving just for time's sake. Okay, so again, there's going to be a lot of information presented in here, but as you all are here, right, cancer can affect our financial well-being. Yes, yeah, absolutely. And there's two big ways that it does. So increased expenses due to medical treatment, and then decrease of income due to change in employment status. We're going to go through these kind of 2 broad things today. All right. Cancer is expensive. Is this news to anyone?
Yes.
This is the first time I'm hearing this, right? All right. So blood cancer in particular can be expensive. There's a lot of new treatments coming out. That's good for y'all. There's a lot of research. There's a lot of funding going into LLS and similar organizations. There's a lot of advances being made, as I'm sure you'll hear in the disease-specific talks today. You haven't been to one, and I'm sure you'll have that insight. At the same time, a lot of blood cancers can be chronic, meaning they don't fully go away. They're things that have to be managed. So that can mean ongoing medication, ongoing sort of expenses, ongoing trips to the doctor, ongoing scans. Yeah. So this can require long-term treatment. Like I said, many treatments are new, they're novel, and therefore more costly. Every cancer is unique as well, and treatments can be unique. This means treatments costs can vary widely. They might talk about trying a first-line therapy. That's not well tolerated. They'll try a different type of therapy. So it can be very confusing, especially for the patient. It's not like walking into a cafe and you get list of prices. It's like, I want the most effective treatment for me. And right, cost kind of comes down the line, like, oh my gosh, right, this is the best treatment, but how am I gonna pay for it? All right, so if you don't have medical insurance, obtain medical insurance. Right, this may not be applicable to everyone. In particular, this is for individuals who've had to stop work and don't have insurance, because in this country, if you're of working age, below the age of retirement, there's not a great way to access insurance. We'll talk about that in a second, but that can be a really big issue. If you're above the age where you can qualify for Medicare, that's not as big of a concern, but it's really, that age right before retirement, if you're still working, or trying to get through that, where it can be a little challenging. So we'll talk about that in a second. You can have increased costs from transportation, medical supplies, and there are a bunch of grants available that we're going to talk about in a second. So obtaining medical insurance. So the predominant form of medical insurance in this country is private, and it's usually employer funded. This wasn't always the case. It was a benefit that was given to soldiers coming back from Blue Cross Blue Shield after the war, World War II. It's a little bit of history. So that kind of transformed our healthcare system into employers provide health insurance. That isn't true for all first world countries. It is true for the United States. So that can be challenging. Medicare, Medicaid, sometimes these can be confusing. Medicare is for older adults, and Medicaid is for those with low resources and are medically needy. It's possible to have Medicare and Medicaid, and so again, we'll talk about that in a second. Affordable Care Act, this has been referred to as Obamacare. Marketplace insurance is another way to term it. This is really, if you're below the age for Medicare, you don't qualify for Medicaid, your two options are you can try to go it alone and see if you can buy insurance by yourself, which is extremely cost prohibitive, or you can access Marketplace. So just a note on this, if you are interested in accessing Marketplace but don't quite know how to do that, there's a great organization, I'm not sure if I included it on here, but it's called Insure Georgia, so insurega.org. Insurega.org. They're a fantastic organization. They've spoken here before. The reason I like them so much is so often when you talk to health insurance agents, they're trying to sell you a plan. With Insure Georgia, they're trying to get you educated about what plan might work best for you. They're not trying to sell you a plan. They're not going to try to push you a plan. They're trying to kind of figure out what plan works best for you, and if you could qualify for any type of grant that could offset that. Easy to set up an appointment with them. Just go on their website and book an appointment. Any questions on medical insurance that comes up for you all? All right, keep going. Okay, so there's a ton of different grants available. Some that may be available through your hospital system. Some that may be available through your medical oncology group. Some that are statewide, some that are national. The ones that are more local are easier to access. You're more likely to get them because there's less competition. The more national a grant is, it's usually better funded, but there's usually more quote-unquote competition for it. So those funds tend to run out quicker, even though they're funded more. All this said, right? How can I know about all these grants? Talk to your social worker, right? It's really important. If you don't have your social worker and you still don't get it, you can email me, right? So I'm still a social worker, and I'd be happy to point you in the right direction or find you the social service team, right? So if you're still running the brick walls, you don't have a dead end, just reach out to me. With that said, there's a lot. Do you all know that there's grants available through LLS? Who knew that there were grants available So everyone else, right? If you haven't applied, there's money available for you. It's just money sitting on the table. It's not a ton of money, but it's not nothing either. So there's a patient travel assistance grant. Cancer Care has a travel grant. An American Cancer Society. So they had a very robust road to recovery program pre-pandemic. It's starting to come back. Yes, ma'am.
I don't want to interrupt you every step of the way.
No, go ahead.
Real quick while we're on this. Long story short, the LLS, the grant that they have, long story short, I had called to see if I could get it, and they always say there's no funding, no funding.
No funding.
And then it just dawned on me one day to ask them, well, when should I sign back up or call in? They told me, call after 1 p.m. And I'm like, had I not asked them, I would not have known.
Right.
You know what I mean? I'd have probably waited months or a week, or, you know what I mean? She was like, oh, call back after 1 o'clock. And I was on the phone at 12:59, and at 1 o'clock I got it.
You got it. Okay.
Yeah, but you know, how would I have known that? You know, even when I called them and they would say there's no more funding, no one voluntarily said, well, call back after 1. Just because I asked, well, how does this work? When should I contact you guys again? He said 1 after 1.
So like you said, you don't know what you don't know.
Yeah,
right?
exactly.
And there are a lot of parts within the system, even in well-meaning organizations. And I love LLS, right?
Me too, I love
So the biggest part of that is, right, if you don't know, ask someone. And sometimes it's that easy. Sometimes they'll say, I don't know, right? Talk to this person. But don't give up, right? Because there are things available out there. You're not out there by yourself. So thank you for that. So if you're trying to apply for this grant, apply after 1 p.m.
Right.
That's the knowledge that you're getting by being here. Okay? All right.
The social worker. Have to have a social worker. Well, the social worker told me one time, just check out the Leukemia Society. They have different programs and different grants. So I started following it online. And then I seen about the financial assistance. And then I heard it talked about in like a couple of these things that I had attended. And so I said, okay, let me call and see about it. And, you know, I would call, and they would always tell me, well, we have no funding. Or you could look on the site and it says no funding, but I would call anyway. So when I would call, they'd say, no, we don't have any funding, we don't have any funding. So I finally asked, well, when should I call back, a week or so? Or she said, oh, call back after 1. Just because I asked that, had I not asked that, I'd probably waited another week and they'd have told me no, you know what I mean? But
So ask questions.
You gotta ask.
That's the story. Ask
if
questions.
you sound stupid, ask.
And believe me, you don't. There's just a lot of things. There's a lot of moving parts here. So ask questions. A lot of times, no one's going to be like, oh, you're silly for asking that. And if they do, there's bigger issues there. So the other thing that can happen too is you can't afford medical supplies, right? So some medical supplies may not be fully covered by insurance. Talking about things like durable medical equipment, things that need to be replaced continually. There are organizations that help provide these. Does anyone know about FODAC, so Friends of Disabled Adults and Children? It's a really, really great organization. I believe they're based out by Stone Mountain. And they get all sorts of larger medical equipment that gets donated to them. Wheelchairs, scooters, things that might be difficult to obtain otherwise if you don't have insurance. So check out FODAC if you're looking at purchasing a large piece of medical equipment, hospital bed, things like that. They may have access to that, they may not, but that's a really great resource. Georgia Lions Lighthouse Foundation, they can help with glasses and things like that. So again, not necessarily directly medical, but there's a number of different resources. Again, you don't have to know all of these. These are put on here, and again, you're gonna have this, but contact your social worker too. They may have a few leads. Yes, ma'am?
Everything you're talking about is Georgia-based. Not everybody in the conference is from Georgia.
That's a great point.
So what about those of us that are not from Georgia?
So,
Information is pretty immaterial to us.
so the biggest thing that I can say is contact your social worker. Some of these are national organizations. Some of these are specifically Georgia, you're correct. Not all the information I'm going to be presenting is Georgia specific. There are some things here, because I was a Georgia social worker, I have more knowledge on that. At the same time, this is widely applicable to anyone in the country. Contact your social worker. There are, LLS is a national organization. That is something, those grants are available to you. The resources that I'll present at the end of the slides will have national kind of implications. So while there are specific examples here, this is more of what is available from state to state. These things are pretty consistent. So what state are you based in? Tennessee. So there are similar organizations I do know that exist there. I don't know the specific names. Have you made contact with your social worker?
We don't have a social worker.
You don't have a social worker?
No.
Okay. So in that case, so have you asked your medical team to provide a social worker?
I don't know.
Okay, so that would be my first step. So again, so some of these things are, this is kind of a basic introduction to a lot of these things. The social worker will be able to provide those local resources for you. My contact information, I'll put it up at the end here. If you're still running into barriers, contact me, and I'll do that specific research for you, for Tennessee, okay? And that goes for anyone. If you're from another, is anyone, who else is not from Georgia? Okay, so you're not, okay, so this goes blanket for anyone. If anyone has specific questions and you're running into barriers in your state, contact me. I'll do the research for you and provide those specific resources, okay? All right. So if you see any Georgia things, right, that may not be relevant explicitly to you, but some of the other things will be. So so these top 3 grants, these are all national. All these things are available state to state, no matter what. Cancer Care is a national program. LLS national program, American Cancer Society. These are Georgia specific, but your county health department, you have a county health department. So that's a great point. No, so if you're from a different state, not all these will be applicable to you. But even if you're from Georgia, not all these necessarily will be applicable to you. Okay. Yes, ma'am?
Yes, I got my first grant through my doctor's office.
You got your first grant through your doctor's office. How did you find out about that?
They asked me.
They asked you.
Right.
So that's wonderful. And there are some doctor's offices that do that. Do you need assistance? I can provide those for you. Some have those grants, but like you were saying, they don't necessarily let you know about those
Right.
things.
It was a,
Not all the time.
it was
Sometimes.
PAN.
Yeah.
PAN Foundation.
So if you don't think there's a grant at your doctor's office, what should you do? Ask, right? Ask. So again, this may not have been your primary focus when you're moving through because, well, I have cancer, I don't want to die.
Here's cancer.
Yeah, I don't want to die, I don't care what it costs, right? Well, a few months down the road, while I'm still alive, and now these bills are mounting, right? So a lot of times that's when it becomes more, when the bills start coming, and it's like, wait, hold on a second. So ask. And again, if you're running into barriers at a doctor's office, contact me, right? I've been doing this for close to a decade, so I can usually find out who's the person in charge that might need to help you, or I'll do the research myself, right? So anyways, let's keep moving through here. Okay, so this is the LLS Patient Aid Program. Here's the phone number. There's some eligibility requirements. Be a citizen of the United States, the U.S. or Puerto Rico, or a permanent resident, so you don't have to be a citizen. You have to have a blood cancer diagnosis and be in active treatment. So this is not state specific. And LLS has social workers too. So you can talk to a social worker. And they have wonderful staff there that will be able to navigate you through this. Again, you don't have to write all this down. This will be available to you. But I just wanted to show you kind of the eligibility. Insurance may not cover the full treatment. So insurance may leave a percentage of medical expenses to be paid by the patient or the family. This is called the patient portion, or your deductible, or co-insurance. They have a lot of different names for it. The bottom line is you have to pay it. Yeah, so you have insurance, I'm covered. Oh, well, sort of, right? Even with Medicare, you're covered at 80%, right? That's with standard Medicare. If you have Medicare Advantage, you may have different coverage rates. But the bottom line is, even if you have insurance, you're going to have some out-of-pocket expenses. Financial assistance available through your healthcare provider. If you are getting treatment through a hospital system, like a major hospital system, they often have, all hospital systems have a charity care program or financial assistance program that sometimes can help with the cost of expenses. So that's very important as well to check out. Or through your doctor. Medical oncology office could have smaller grants that are available that can help offset the cost of payment, even if you do have insurance. Sometimes drugs are not covered by prescription drug plans. There's also prescription drug assistance. So this is what I mentioned before. If you're treated by a hospital, financial assistance can be extremely useful for any inpatient stays. So if you have an inpatient stay where you're neutropenic, or you have to come in for an infusion, or something where you have to stay unexpectedly, that's the other thing that can be confusing. There are different silos for this funding. Again, you don't have to know all this. You need someone to ally with you, i.e. your social worker. Don't have one, contact me, we'll get you linked up with one. And it can also help pay for diagnostic testing. So again, it's important to know what procedures are being done by the hospital, what's being done in your doctor's office, and there are different financial assistance components for each. It can also help pay for the portion of your medical bill not paid by insurance. However, it can take several weeks to have this approved. Even if you don't feel like you would qualify for it, it's worth applying. It's not going to go on your credit or anything like that. The thing about it is most hospital systems are nonprofits, or they have some sort of nonprofit designation. What this means is they're required to give away, at least hospitals are required to give away a certain amount of care, or they have to pay taxes. So they'd rather give away money. Again, they're never going to tell you this, but this is just my experience, right? So there's a certain amount of portion that they have to give away. They'll never reveal that number. But if you don't ask, you don't know. So again, even if you feel like, oh, I wouldn't qualify for that, I made a lot of money, right? You might be in a different financial situation now. It might be worthwhile to check out. The worst they can tell you is no.
So when you say healthcare provider, you're talking about the actual hospital or the...
So I'm talking about both.
Okay.
What you'll probably notice is that if you stay in the hospital, you'll get several different bills. Bill from the hospital.
Yeah, I got sent to the hospital. I got operated on.
So they'll have their own financial assistance department. So talk to the hospital for that. They may not cover, though, your outpatient procedures.
Right.
So that's why it's important to talk to your outpatient specialist as well. So they're different silos, and that's why it can be confusing. It can be confusing. At the end of the day, we can throw our hands up, right? What I'm saying is there's a logic to it. It isn't always revealed to the patient. So yes, if you stayed in the hospital, oftentimes there's inpatient case managers, which are different than your social workers, but they can help get you linked up with the financial assistance through the hospital. Again, if this is all confusing, you're not sure which way goes what, talk to your social worker. That's their job to help connect those pieces for you. Yes, ma'am. Yep.
Are the majority of these programs income-based?
Yes. The majority are. Not everyone, though. Some will have different requirements, but in general, I would say the majority are. Yes.
One of the slides was talking about the requirements. It said being monitored by a doctor. Can you define what that means? Because I've noticed for people who don't necessarily want to go the traditional route, there aren't any resources for them.
So that you're talking about the eligibility requirements, being in active treatment, scheduled to begin treatment, or being monitored by their doctor. That's a great question. I don't know this specific exclusion criteria, right? You're saying if there's, my guess, and I don't know, but if you're being monitored by a health practitioner of some kind, that might suffice. It depends though, and I don't know. So that's where I would call this number here and kind of talk to them about that. But that's a great question. I would not let that deter you, right? Just like over here, right? Ask. Because what we're still saying is, no, you need to have an MD do it. And even with that, right, you might be able to have, right, even if you're not getting treatment from a doctor, you can get an opinion from them. And because you've seen them, that might suffice, right? So you don't have to, if you're, right, if you're seeking alternative treatment or you don't want standard chemotherapy or things like that, don't think that you have to do that for this. I would ask the question first, and there might be ways around that. Yes?
And I'd just like to add to that, because I was one of those people who didn't want traditional chemo at the time or whatever. And I thought, every time my sister had told me about this LLS thing, copay assistance, and I think they were doing like a $11,000 copay assistance thing. But I remember the first year I didn't even apply for it because I let that little caption there think I wasn't eligible because I wasn't doing what they wanted me to do.
Yeah.
So, but to my surprise, like the second year or whatever, I said, I read something when it said monitored by your doctor, and I was like, well, monitored, I do go to the doctor and I do get labs done every 3 months or whatever, so
Yep.
that monitor,
Yep.
and to my surprise, it worked. I applied for it and I got it. So.
Well, and I do know just from working, thank you for that, and I do know working with medical oncologists, that not everyone wants to pursue that standard treatment, or they're unsure, right? But they still want to be in contact with a doctor to monitor if there's progression. So a lot of those doctors, even if they have discrepancies in how they might pursue treatment, they're still willing to work with you. They want you to check in with them. So I know that that setup happens, and right, you're ultimately in control of your treatment, right? So, and the other thing I'll say, right, is just like those jobs, right? Like you get right out of school or something, and it's like you have to have 3 years of experience for this entry-level position. Well, give them a call, right? See if there's other, right? A lot of times that weeds people out, right? So we call that as rationing by inconvenience. Don't let that get in your way, right? Ask the question. First to say is no, you have to have chemo. Right? Well, okay, thanks. Right, I'm gonna go about my day. All right, okay. I'm gonna go ahead. Okay, so prescription drug assistance. So you see a theme here, right? So let your treating doctors know if you're having trouble paying for drugs or any part of your care. And this is maybe right, you'll see a common theme here. A lot of people who come in to seek treatment just aren't super vocal or don't feel like, right, they want to share all of the challenges that they're going through. It's not how they were raised, it's not what they wanted. But guess what? To the doctor, that seems like everything's okay. If we don't hear anything, then we assume that everything's going okay. We'll ask questions, but a lot of times, the thing that will raise the alarm is if the patient says, I'm not doing okay. And it doesn't just have to be about medical stuff. I'm not doing okay at home. I'm not doing okay with rent. I'm not doing okay with this. Your doctors want to know, even if they don't say it. That's not their primary charge, so they may not ask you about that. There are doctors that are more compassionate towards that. We can't count on that always.
That's true.
You might have a brilliant doctor who can help cure your disease, but they may not ask you a thing about how you're feeling emotionally, right? Doesn't mean it's not important. It doesn't mean they don't care. It means that there's a lot of patients that they're dealing with, and they have a lot of high-level things to look at. So, right, think about this as not just your doctor. You have a team of people around you, and if you don't, we'll get you linked up with that, okay? That's how proper cancer care should happen. Yes, ma'am?
Yes, you mentioned Blue Cross Blue Shield a bit earlier, and of course we're, as you know, entering the session where you make your decision for your upcoming year for insurance. Blue Cross Blue Shield used to have a
changed a lot of stuff.
Do you want the real answer?
Yes, please.
Because it costs too much money, and they're in the business of making money. I mean, that's what insurance, right? Your doctor and your team, they care about your well-being. Insurance companies, well, I'm not going to say that. But their primary charge, they're a profit-making entity, right? They don't see you necessarily as an individual person with individual needs. I say this with, right, I have insurance too. I depend on insurance. We can acknowledge two things at once, right? So that's the bottom line. A lot of these costs, and that's why a lot of marketplace plans went away too. You may notice there are less marketplace plans being offered or new plans that are in. Some found it untenable, or some found that it didn't make sense financially. That's the short of the answer. If you want the true answer, follow the money. At the same time, right, what I might say, the PC answer might be, well, there might be other plans that could serve a similar need, and maybe they found that that plan wasn't being utilized at a high enough rate to make sense for their patient population. But I'm not a Blue Cross Blue Shield spokesperson, so I don't have that obligation. My obligation is to y'all. So I can't tell you exactly why. I wasn't in the board meeting, but that is my sense, and I've seen that as a trend happening more and more. Less kind of robust plans are being offered, and you may notice that you're being asked to pay more from your deductible or co-payment.
Yeah.
Those are changes that are being made to Medicare, if they haven't already been made, that you may have to end up paying a little bit more into it as well. To keep
I
it
think
going.
your answer was right on the head.
Yeah. I wish it wasn't. Yeah. But.
Do you know if what G offers?
Oh, I don't know. I'm sorry. I don't know the specific plans because they change every year too.
Yes.
Yeah. So again, we could talk a long time about that, especially the negotiations that happen. There are, negotiations every 3 years. I know Piedmont made the news because they weren't right on the same page with United Healthcare or Blue Cross Blue Shield. They were out of network for a few months and then they made a deal.
Yeah.
It can be very messy and complicated. You don't need to know all of that, right? You need to have an advocate who's. Do you have a social worker?
Exactly. I have one, but
You-
she's overworked.
All right. Okay.
There's a whole nother conversation right there too.
Well, tell your doctor that she needs an assistant, right? So we can advocate for our social workers too, but you can have other folks. You can reach out to LLS, and we'll talk about a few other organizations that also have social workers that you can contact if you don't have one in your local vicinity. Or you can join our blood cancer group. And guess what? I'm a social worker, so I'll work for you. No cost, right? I don't have any cost. All right. Okay, so let's see. Oh, this is a cool thing. Sometimes physician offices will have samples. So sometimes you might need to go on a blood thinner. They have just packs of blood thinners. Hey, try this. Try this different thing. So that can help offset costs. Sometimes you can obtain drug discount cards. This is not up here, but, oh, yeah, it is. Does anyone know about GoodRx?
It don't work for
Yeah.
me.
Everyone knows about GoodRx.
But I don't.
If you don't know about GoodRx, you need to know about GoodRx.
I know that.
Because even if you have
It don't
insurance
work for me.
with a drug prescription plan, GoodRx can sometimes be cheaper. And there's no cost to signing up for it. In fact, you can go online, type in your specific prescription, put in your specific dosage, and it can tell you what the cost is and where you can get it. It's a bit, I thought there was a catch. You don't get anything for free, right? There's no such thing as a free lunch. So I was very skeptical. What do you want? What do you want, GoodRx? When am I going to get the bill? I've used it a bunch, right? So I first used it with my patients, and I was like, hold on. This is cheaper than for some drugs that I get. It's actually cheaper. So you may be surprised. Sometimes it's not, but it's a free thing. It gets a lot of funding. So they get a lot of donations and funding, and they turn that into benefits for y'all. Anyways, you can at least compare prices. makes it more similar to, right, if you're going clothes shopping or car shopping, right? You can see the price tag and kind of compare the prices. Whenever you can compare prices, that benefits you. When you don't compare prices, or if you can't, you just pay what's available, right? So the more that you can have different options, the better that is, the more that empowers you. Some other things. LLS also has a copay foundation, right? We talked about that. Needy Meds is a great one. Needy Meds can sometimes have larger infusion benefits. You can look this up, but really this is your social worker's job. So, again, if they're overworked, you might help them out a little bit, but all these are very similar. They can help pay for copays, or, right, if you have, let's say, 6 sets of infusions, and you can't afford the copay for that, see if you apply for this. And while there is a financial requirement, a lot of times they're pretty generous, like 500% of the poverty level, or 600% of the poverty level. Poverty level is pretty low, but 600%, that gets kind of into middle income. So, right, just because you feel like you're doing okay, or right, this is for really needy people, well, you know, given the financial stresses, maybe y'all need some help too, right? So don't think that it's not for you. Let them tell you no. Don't count yourself out first, right? Okay, so before we go on, right, so these are the costs of, does anyone have any questions in general about the cost of treatment? I'm sure you have a lot of questions, but anything that kind of went over that you wanted to have any more information? Okay, good. All right, so decrease of income due to change in employment status. Now, even if you're not working, some of this may be relevant to you. All right, so cancer treatment, even less aggressive cancers, can lead to extreme fatigue, pain, and difficulty focusing. This can make it extremely difficult or impossible to work for a short time. So you want to familiarize yourself with specific employee benefits and use wisely. This is more for individuals who are specifically working right now. Again, this is a lot of information. I'm not going to go over all of this, but what you need to know, right, is Family Medical Leave Act requires certain employers to grant family medical leave when needed for 12 weeks during a 12-month period. They're required to continue your health insurance coverage as if you were still working. FMLA does not give you money. It is a right or a benefit that you have by virtue of working for certain organizations that have over a certain number of employees. So what that means is you can take time off of work, your job will be secure, and your insurance will still be in effect. This does not give you additional income. This is not the same as short-term disability or Social Security disability, which does provide income. So FMLA is a lot of individuals who are like, well, I don't want to take time off of work, or I want to use my PTO, I'm afraid I'm going to get fired, or this sort of thing. This is your right as someone who lives in the United States and works for a company over a certain amount. So this is a federal law, and if employers don't follow it, they're in big trouble. So all employers, I haven't had anyone get pushback on FMLA because there's federal regulations that guard it. Short-term disability insurance is not a federal benefit. It's not even a mandated benefit. It's just something that's provided by some companies. And it's typically much less. Some people I heard had really good short-term disability, cover at like 90% of their income. Usually it's more like 40%. So it's not going to fully replace your income, but it may be useful if you can't work at all. Short-term disabilities are generally purchased individually, administered through your employer, and provided by your state or territory, depending on if you work for the state government. So again, generally STDIs programs will cover up to 26 weeks away from work and pay between 55 and 100% of your wages I've seen as low as 40. I've never seen a 100% short-term disability. If you find that, let me know, and I'm gonna go work for them.
Right.
Human resources is a great element, right? They're kind of like your employer social worker, not really, but sort of. But they can educate you on your benefits if you don't know what those are.
Can you purchase short-term disability if you're self-employed?
That's a great question. I actually don't know that answer. So that's something I'll need to do more research. Generally, so that is a good question. There may be organizations that do offer that.
I found a lot of credit unions
Mm-hmm.
and that you don't necessarily, like in Atlanta, the Delta Credit Union, you can be available if you're like employed or live in a certain area that's close to one of the locations, you can apply. And I know, like, that's how I got it. And they offer a lot of life insurance programs, SCBI, stuff like that. It's, I would say, reasonable. You know, it's not super cheap, but it's, you know.
I do know that there are insurance, so like Aflac, things like that.
Yeah.
They provide insurance for if you can't work. It's not called the same thing, but the benefit is similar. So I do think that's out there. I don't know exactly, because there's a lot of different plans and you would be purchasing it individually. But that's a great, so credit unions.
Yeah, especially like I said, the Delta Credit Union is probably the biggest one here, you know, in the Atlanta area, or at least
Georgia.
in Georgia. And they are relatively easy to join, like I said, due to where you live, where you work. Like, you know, if you're in Gwinnett County, for example, you're eligible to join the Delta Credit Union. And then they have all kinds of, you know, life insurance, short-term disability, car insurance. And some of the stuff is, you know, not so priced, so great, like the car
Yeah.
insurance. It's like, yeah.
Yeah.
You know, but some of this, I mean, they've got a life insurance supplement program.
Yeah, supplemental insurance.
That, you know, are pretty reasonably priced.
Yeah, the other thing, that came into my mind, so that's great. And there are a lot of credit unions. So Georgia's own, Delta, there's a lot of different local credit unions. If you're in another state, every state has a credit union or multiple credit unions that can be helpful. The plans may not be super competitive, or they might be, right, you have to weigh if it's worth it. Just like buying health insurance by yourself, not on the marketplace. You're gonna pay a premium. Because you have very little negotiating power compared to, a company that has maybe hundreds of thousands of employees. They're gonna be able to get a better rate for that. That doesn't mean that it's not available. It just may not be financially beneficial in the long run. But that's something that you'll have to weigh. But that's a great question. I'm gonna do more research on that. So, let me see. All right. So, the other thing is you may find that you take your FMLA, get your short-term disability benefit, but you realize you're going to have to extend past FMLA, and now you're looking at perhaps an early retirement. I don't know, you're kind of on that cusp. So that can be a really difficult place to be in. So one thing that does become available when you get closer to reaching retirement age is Social Security. All right. So there's different types of Social Security. Again, this can be very confusing. Long story short, you can go to benefits.gov to check your eligibility for different programs. So if you don't want to read all this, you can go to benefits.gov. But there are two main Social Security aid programs. Social Security Disability Insurance, SSDI, and Supplemental Security Income, SSI. SSDI pays benefits to you and certain family members if you've worked long enough and paid Social Security taxes. So this is where they talk about, do you have enough credits? What are your credits? Have you worked 30 credits? That's SSDI. Typically, it pays a little bit more than SSI, but there is a credit requirement. You have to have worked a certain amount and paid it. It doesn't have to be consistent. Like, you could have taken some time off and worked, but there's, you have to have an accrued, I don't know the exact number, but there is a work requirement for that. SSI, you don't have to have a work requirement, and it pays benefits based on financial need. Typically, this is administered through Department of Family and Children's Services. It's a lot of times, if you qualify for Medicaid, you will also qualify for SSI. So these two are different, though. One is for financial need, and one is, it's not based on financial need. It's based on your work history. If you're of retirement age, 62 and older, you may be eligible to apply for Social Security retirement. So this is where the kind of like cost benefit comes in. So I have a lot of clients who are 61, going to turn 62. Should I go back to work? I don't really want to work. Right? Do I take Social Security? But then, so this is a permanent penalty, which kind of is not great. So, right, what this means is that your benefit is reduced permanently. So, right, if you were to receive something like 2,000, it'd be closer to like 1,600 forever. The benefit, though, is that you get it 3 years earlier. Now, I think to be fully vested, you have to be 66. I don't know if the age has changed.
67.
67, okay, so I need to update this. So 67, thank you. So, right, and they're probably going to keep pushing that up, unfortunately.
Trying to get you the grade food.
Right, it's like, well, so that's the other thing, right? Do I need this money now? I mean,
Yes.
what's it going to matter in 3 or 4 years? If I don't have this money, I'm not going to make it that far, or I'm going to be struggling, and life is going to be miserable for another 3 years. Is that worth it? Right? So again, you shouldn't make this decision alone. You should do it in partnership with someone else who works with these benefits, who helps, who is their job, your social worker, or a suitable social worker that doesn't work for your medical office. All right. You can also contact your local Social Security office, ssa.gov. Social Security disability can be a very difficult thing to get. Don't let it discourage you. Again, don't do it alone. You can apply for it by yourself, but it's a very convoluted process, and it can take a long time. So it's good to have someone in your corner to help you with that. But this is, if you want to look it up, benefits.gov for eligibility, ssa.gov for your application. Again, this PowerPoint will be made available to you. You may still be unable to afford everyday expenses like bills, groceries, non-medical costs, right? So we've been talking about medical costs. We're talking about non-medical costs.
That's a big thing.
So many foundations offer assistance for bills, housing, food, insurance, and after surgery treatment supplies, wigs, hats, lymphedema sleeves. Each foundation has their own criteria for awards, okay? And this is what I did most of the time as a social worker when I worked at Piedmont. A lot of people had difficulty paying just to live. And if that's you, you're not alone. And there are things out there to help you. A lot of these organizations can be local, faith-based organizations. There can be other organizations that aren't specifically cancer related. So again, right, those things may differ from county to county. So even within Georgia, I can't give you a blanket, organizations that you should reach out to. You are not responsible for knowing all those organizations. Your social worker is. And so a lot of these, some of the best funding comes from local grants, from local organizations that want to help, but nobody's accessing them because nobody knows about them. As opposed to national foundations, which again have more robust funding. They get funded more frequently, and so while there may be more money there, it may not be as accessible to you.
question. You ever heard that Let'sGo.com guy? The crazy dude with the glasses and the question marks all over his jacket?
Not.
Let'sGo.com. He charges like $8 a month, and he gives you all this access to different grants that are available for damn near everything, from car repair to you.
Oh, I'm not familiar with Let'sGo.com.
Lesco.
Les-
L-E-S-K-O.
Lesco.
Lesco. That's the guy's name.
Okay.
He's been around since like way before the internet.
Okay.
And he's a cracker looking dude. I mean, like nutso looking guy.
I'm not familiar with him, but
I think I know who you're talking about. Who wears glasses?
Yeah, it's like 80 years old. But I mean, seriously, back in the television commercial days, he would come out and he would hawk this big old book. But now he's got like a website, a whole organization, and I think it's for those kinds of things, it's $8 a month to try to use it. And especially in the social work kind of stuff, and people like you're talking about trying to get local grants, because he encourages a lot of that kind of stuff. It's not easy to use, and especially like with a lot of the grants and stuff, and you have to do legwork. You actually have to apply. Nobody's going to do these things for you, as you said before. But as you go under, I don't know how much help the guy is or not, but I know he does a lot of business.
He's been on infomercials for years and years. I think I know who you're talking about.
Yeah, he's still
Did you say let's go, L-E-T-S, go?
L-E-S-K-O.
I'm sorry, spell again.
L-E-S-K-O. Let's go.
okay.
He ain't free.
Well, so we're actually out of time today, but I will be available after, so we can talk. But these are the national foundations, and these will also be available to you. These are all, these are all national. And yeah.
Your email?
It's my email, yes.
Excuse me, did you say we could get a copy of this?
Yes, it will. If you participated, you will get sent one. We don't have paper copies.
Okay.
But there's my email.
Mark W.
Wait.
Can you speak that out? It's kind of hard to see back here.
Sure, it's my name. It's M-A-R-K. W. Flanagan. F-L-A-N-A-G-A-N. The number 1 at gmail.com. And
All right, guys, so this concludes our first session this morning. So thank you so much, Mark, for being here. Thank you guys for participating. If you have any questions regarding LLS and our specific programs that we offer, we do have information specialists in the ballroom that'll be waiting to answer any questions. Before you go, though, you should have been given an evaluation when you checked in. We do ask if you guys fill that out. Your input is really critical for us, so we can make sure we're meeting your needs for our blood cancer conferences. But you guys are good to go. Lunch will be in the ballroom before your next session starts. Thank you.